Okay, so things to know right now, and we're so pleased and proud and privileged to be bringing you information, especially right now. The pro staff has really stepped up to the plate. We are all very busy from our new and different ports, but we're doing this. So, do you have dyskinesia, or what is dyskinesia? Is it getting in the way of your life? Is your tremor giving you and your family fits? You can't eat, you can't sleep, you can't. Have you thought about deep brain stimulation? Short term is DBS. What is DBS? Hello, this is Joe Rosen, President of Parkinson's Resource Organization, and we're bringing you things to know right now. Introducing you to a young lady that is filled with passion and compassion. She's tremendous information and tremendous with people with deep brain stimulation. I've personally watched her in action. I've been with someone who underwent DBS and watched Chelsea interact with the physicians, interact with the medical staff, and in particular, interacted with our member. So she is with Boston Scientific, a medical device company that has created a new and very effective deep brain stimulation system. Welcome, Chelsea, and perhaps let's start with the definition of dyskinesia in case our audience doesn't know what that is.
Yeah, so dyskinesia is, involuntary movements that people with Parkinson's will experience, kind of that wiggly motion. And then, deep brain stimulation, as Joe mentioned, also known as DBS, as we might refer to it kind of throughout this conversation, is a surgical option for patients with Parkinson's disease that helps with the motor symptoms of Parkinson's. So tremor, your rigidity, your bradykinesia, which are those slow movements. And yeah, it's a surgical option. It's not a cure. As you all know, we don't have a cure for Parkinson's disease at this time, but what we really see is a good quality of life for people that undergo deep brain stimulation surgery.
So DBS can be worked for dyskinesia. It can be worked with or help with people with tremor.
Correct.
And what else might it be helpful for?
Yeah, again, so like kind of those main things. So we talk about the motor symptoms of Parkinson's. And when we talk about that, that's going to be your tremor, your rigidity, your bradykinesia, which are those slower movements. And then, yeah, dyskinesias as well, depending on if that's something that is bothersome for you.
Okay. So things are lifting now thanks to COVID-19 going a little bit underground. And
Yeah.
I know that there was a while where DBS is considered an elective surgery. Has that opened up?
Yeah, so every center is a little bit different. And, I know we have people that tune in, not just in Southern California, but, all over the country. So I would say in California specifically, we did get the notice maybe about 2 weeks ago or so that they were starting to open up facilities for elective procedures. But things are still a little bit different when you go in. Everyone's taking precautions. Maybe a family member isn't allowed, back into the areas that they used to be allowed into, but we're figuring out kind of the new way of how things are going. But yes, I would say a lot of centers are starting to open up after the shutdown, yeah.
So can this be done at any center, at any hospital, or are there just specific hospitals that do deep brain stimulation? And if that's so, why is it? What are the prerequisites?
Yeah. So DBS is a very, it's a group interdisciplinary process. And when we say that, it means there's a lot of people that have a say in if somebody is going to get deep brain stimulation. So usually it's done at institutions that have a movement disorders specific program. And in that, there's neuropsych, there's a movement disorder neurologist, there's a neurosurgeon, and then that surgeon has also done another training in stereotactic and functional neurosurgery. So there is a specific surgeon, there's a specific neurologist, and it's really a big team approach. I would say your major academic institutions are going to have a deep brain stimulation program. It's, it's nothing new. It's been around for over 20 years. And so these places that do offer it, like I said, it's very specific. But I would say definitely reach out and see if somebody in your area is doing it.
So someone might have tremor and they might have dyskinesia and whatever else they might have.
Mm-hmm.
Can they just automatically are they a candidate for DBS, or do they have to go through some testing to make sure that they would qualify?
Yeah, so there's a couple different things. Depending on where you go and who you see and who you talk to, DBS might be talked about very early on in your Parkinson's journey. Someone might say, hey, later down the road, you're going to want to think about this. When we see DBS really being offered to patients is when their medication is still working, but they're experiencing maybe not as much on time, or they're off time where, you don't feel your best with the medication is becoming more unpredictable. DBS does have a time where it really actually wouldn't be that beneficial for somebody. So if your medications are no longer working, DBS might not actually be the right step for you. What responds to the medication will respond to DBS.
Really good. And so if somebody now is a candidate for DBS and
Mm-hmm.
they're thinking about going into this, I happen to know this, but perhaps you can put some light on it. Is there just a general deep brain stimulation device? Are there more than one? Is it like a Volkswagen versus a Mercedes or something like that? Tell us about the devices that are available.
Yeah, so there's 3 devices on the market. In the US market, Boston Scientific is the newer one to the bunch, but worldwide, we were the second one to come around in 2012. So we're not new to deep brain stimulation, but we're newer to deep brain stimulation in the States. And every device has a little bit of a different offering for a patient. One thing that we're really proud of with our device is a rechargeable battery, which for the most part, a lot of people really didn't understand rechargeability. Maybe it was a little bit more cumbersome. Maybe it just didn't seem like something worthwhile. And what we offer is a very unique way to charge for a patient. It's a very small device, and you actually have one right here. And all you do is, it's a little kind of collar that you wear around your neck once a week for about an hour or so, and it will charge your device just kind of over the skin and whatnot. And so patients that can do that will also get at least 15 years of battery life out of their stimulator and not have to go in for those repeat surgeries.
So we should say then, rechargeable is obviously something very serious to think about.
Yeah.
If you didn't go for rechargeable, what does it mean to have what does it mean, the opposite of rechargeable? So,
right. So we call that a non-rechargeable device or a primary cell battery. And what that is when it's put in you, think of it as a full tank. And then as you use your system, with different settings and things like that, over time, you'll start to deplete that tank, that battery down. And once it's empty, you got to get it replaced, which really isn't a big deal. It's an outpatient procedure that can be done very, very quickly. But it still is a surgery. So if you're somebody that is maybe on, blood thinners or those kinds of things, it's hard for you to get cleared for surgery. Rechargeable actually might be a better route for you.
So knowing that it is available, because it wasn't that many years ago, as you said, 2012 that you came out. So it wasn't that many years ago. We didn't have such an option available. That's number one. Is there any way, or I'd love to get to the audience a little bit of information about what does deep brain stimulation look like? We know that it is it's a surgical procedure where they implant. I know this. I don't know
Yes,
if our audience knows this, but it's an implanted electrode
correct,
that connects underneath the skin to a
correct.
device that gets implanted in the chest cavity. That implanted device is what we talked about as being chargeable or rechargeable. We
Mm-hmm.
can either recharge it with the collar or get a new surgery when it needs to be replaced.
Yep.
So yeah, with Parkinson's coming in at younger and younger ages, is this a costly treatment? Is this covered by insurance? Tell us a little bit about that.
Yeah, that's a great question. It actually is, Medicare covers deep brain stimulation, and then a lot of the other commercial payers follow Medicare rules. Your deductible may just be, you know, once you hit that or whatnot with your personal insurance. I don't have a hard number for you
And that's
because
okay, just as well,
every
because
procedure is a little bit different.
where I was headed is we've got people who are, in their 20s, 30s, 40s, and 50s. Obviously, they're not Medicare eligible. So now we
Yep.
want to know if they have insurance. Do
Mm-hmm.
insurance companies typically cover this, or
Yep.
do you have to advocate a lot for it?
Yeah, they do actually. Once your physician realizes, that you are a candidate and you're moving forward with the procedure, you're going to get a neuropsych exam. You're going to do what we call an on-off test with your neurologist, where you'll come in off medication. They'll do your UPDRS 3 testing, which is the motor function of that test, and then they'll have you take your medicine. And if you score in a certain range, then you would be eligible for surgery. And they'll do the pre-authorization process usually for you kind of on the back end. But there's a little bit of work that you need to do to actually get to the starting line of everything. And like you said, younger patients are being diagnosed, and don't think of surgery as a last ditch option. It actually can really kind of extend and help those younger years of your life where you really do want to be active and you need those that on time to be more predictable and not so, oh my gosh, I'm out with my friends or I'm out doing an activity and my medicine might, stop working or whatnot.
Yeah.
So don't think of it as end of the line surgery. It can be a supplement and another tool in the toolbox your physician will use to kind of treat your Parkinson's.
And so, from experience, I know that some people go off all of their medications, others stay on the same medications that they were on. Is there
Mm-hmm.
any particular right way, wrong way with medications?
As you know, I mean, Parkinson's disease presents itself very differently in everybody, and everybody's on some kind of different dose of medication. So just like that, that's how the deep brain stimulation is as well. The target that they put it in, and we say target, that's the specific area of the brain, can change. How you react to that can change. Maybe you have more tremor and I have more rigidity. So maybe there's going to be certain things that we're targeting. But these are great questions to ask your neurologist. What can I expect my quality of life to be like after surgery? And I think it's important to have that conversation, because the worst is if somebody gets implanted and the surgeon and then the neurologist really want to treat this thing, but for you, you really wanted something else. And, maybe that actually won't be helped by the deep brain stimulation.
Yes,
So
I think we need a list of questions that the consumer, if you will, the person with Parkinson's, should be asking
mm-hmm.
to cover all of these. We had a situation where someone was informed that they had to take the device that was on the shelf, if you will.
Mm-hmm.
And the surgery didn't happen to be totally successful. And so one of the discussions that we had was, what device did you use? And he said that he had to take the one that was on the shelf, which was not. And so my main thrust today, and talking with you in particular, is to make sure that the audience knows that there is more than one device and they are all different. And as I started out, it's like I said Volkswagen versus Mercedes, but I think I'd rather say a Ford or Toyota, perhaps one of the lower priced cars versus the Mercedes, not for the price range as much as for the value of what is in that device.
Correct. Yeah, I think that's it's a really nice analogy, because I consider us more on that Mercedes-Benz side of things. But yeah, and really, we say too, with our device, because of the way that your neurologist can program the device, think of it like a little steering wheel that they have in your brain to figure out where the problem is and help it. So with our device, we're really able to offer that level of specificity and programming. And you did mention, somebody was told, hey, you have to get this device. I would say as a consumer, you're allowed choices in your device, and you're allowed choices in your surgeon and who does your surgery. And whatever it is, I always tell people, do your research. Come to places like Parkinson's Resource Organization that have done it for you and can help make good decisions for you. But any surgery that you have, it's almost like getting a second opinion or asking a friend or talking to somebody. I think all of those things are really great, because it is kind of new to have options in the deep brain stimulation space.
It's definitely, yeah.
Yeah, you got to be an advocate for yourself.
Yeah, I'm so grateful you came on with us. I know that we could probably take an hour's worth of discussion today, but our intention was to try and get it into 15 minutes. So
Perfect.
Is there anything particular you'd like to tell the audience today before I move on to tell them where you will be in the future?
Yeah, I don't have anything else that I want to add. Thank you so much for having me. If you have any questions, you can follow up in the Wellness Village. My information's there, as well as ways to connect with other patients that have had the surgery. And I know that Joe is really good about telling us about you guys too, if you're out there. So please feel free to reach out. I'm one of 4 people in Southern California here to help you.
Okay, that's terrific. And then we've got some village meetings coming up. Everybody should know that we launched them this last month. And so 2 times a month, we will have what's called village meetings, where we will have speakers like Chelsea and other doctors and lawyers and whoever else can help get through the journey. And we will have them speaking at the village meetings. And so we want to invite you to keep in touch with us for the village meetings. And then that's where you will see Chelsea again. So start making your list of questions now on things that you would like to ask when it's her turn to speak at the village meeting. Chelsea, I am so happy that you are in the life of the Parkinson's world, because you have such passion and compassion. And for all of those that I know that have gotten Boston Scientific devices, you and the other team members have been such a source of just peacefulness and calmness with our members. So thank you for doing that. Thank you for being there. To our audience, stay tuned, watch our YouTube channel, and get all of these kinds of videos there. And Chelsea, thanks again so much.
Thank you so much, Joe. Have a great afternoon.
You too.